Disability caused merely by low back pain increased by 54% between 1990 and 2015, mainly because of population increase and aging, with the biggest increase seen in low income and middle income countries. In India, again there is enough data to substantiate that it is a very common cause of ailment, very common cause of diseases, and adds substantially to the burden. The annual and lifetime prevalence rates of low back pain in the Indian population has been reported to be higher compared to global and other ethnic populations, affecting a large proportion of population, especially women, rural population and elementary workers. And that's what is the importance of SPINE20 2023. It's not only causing a huge disease burden, there is a huge economic burden as well. Back pain is responsible for the highest number of man-hours lost in the industry in the US. In some countries, back pain is estimated to contribute to up to 30% of direct costs, and indirect costs are estimated to represent the majority of overall costs. And so, spinal cord injury, for example, also studies estimate that the cost of injuries is between 0.29% and 0.69% of GDP of India. The Christopher Reeve Foundation projected in 2011 that United States could save an estimate $400 billion by providing SCI-based preventive and therapeutic interventions. So, briefly, what SPINE20 is, it is a non-official engagement group of G20, an advocacy group founded in 2019 in an effort to improve spine care on a global level through recommending policies to the G20 countries that help them alleviate the burden of spine disease through various means, stimulating better spine health, advancing spine research, enhancing spine innovation pathways, and improving spine care and treatment. Saudi Spine Society, European Spine Society, German Spine Society and North American Spine Society were the founder members. But there are 33 societies in addition from across the globe which are collaborating or partner societies to SPINE20. And we have the Partnership Advisory Board also, which these societies constitute. More details, friends, are available on spine20.org for your benefit. And here, representing SPINE20, Dr. Sami Eliza, Speaker-elect of SPINE20. He takes over immediately as the summit ends, and Professor Pierre, Eurospine representative and a very acclaimed professional as well. Association of Spine Surgeons of India, friends, is the host. You are all aware about Association of Spine Surgeons of India, the biggest association of spine professionals across the country. Dr. Soumyajit Basu is the president of the Association of Spine Surgeons of India. He is seated here. Dr. S.K. Srivastava is the president-elect of the association. Dr. Upinder Chahal is the secretary, and Dr. Shankaracharya is the immediate past president. So, we go through an elaborate process. I am representing also SPINE20 here, being on the executive of SPINE20 and being the chair of SPINE20 2023. An evidence-based Delphi consensus process. We decide on a theme for the year, brainstorm on various issues pertaining to the theme, prioritize and shortlist issues with the potential for maximum impact, invite world-renowned experts to present on the recommendations for these issues, deliberate on these recommendations during the SPINE20 meetings, which are held much before this summit takes place. We started in January, on January 16th precisely this year. Invite comments from participants and various world-renowned spine societies and finalize the recommendations by incorporating suggestions. These recommendations are passed on to the G20 Sherpa for dissemination amongst the G20 countries, and they are also published in renowned peer-reviewed journals. So this is generally the process.